I got to tell you, I watched the news conference from earlier this week. Like most people watch sports. I was screaming at the TV. I was so upset by it. And then on the other side, I saw women taking Tylenol just because it's safe on social media. And I was upset by both things. And I kind of wanted to take a beat and take it all in, read some of the statements, and then make a video for you guys because I understand that this is a very confusing time for pregnant families. The good news is that there is always a middle ground, and today I hope I'm going to help you find that. The FDA actually sent out a statement to providers, which is giving us a little bit more information than was given at that press conference. Honestly, the press conference, not very helpful. Please don't watch it. It is not going to help you out, I don't think. Now, in that statement, and I'll link it down below in case you guys are interested, it did show that there might be an association with neurological conditions like autism if Tylenol is taken chronically during pregnancy. Now, I've heard some people say up to 4 weeks, and I personally have not seen a whole lot of pregnant women need Tylenol for 4 weeks of pregnancy, but I'm sure that they are out there. But then it goes on to say that there is no causal relationship shown and that there are contradictory studies to that do not show an increase in autism when pregnant women take Tylenol. Now, the same kind of thing would be if there are an increase in outdoor ice skating incidents during the winter. Is it winter that causes ice skating incidences or lack of skill on the ice skating rink that cause the incidences? So you have to look at what is actually causing it, not that they are just correlated. Ultimately, they said that it is something that providers need to be aware of. And if they can avoid using Tylenol in routine low-grade fevers, again, I'm not exactly sure what that is, the provider should avoid it if possible. As a note, in the medical field, we do not count it as a fever until it is 100.4. And at that point in time, your baby is actually hotter than that, and it can take up a lot of their resources, and it's not good for them. So we don't count it as a fever until 100.4, but at that point in time, we usually take action, and that's something you'd want to discuss with your provider. And then it went on to say that really this is often our only option because pregnant individuals should not be taking ibuprofen or aspirin. By the way, when I read aspirin, I screamed again in my head because of course they recommend low-dose aspirin in pregnancy to help decrease your chance of preeclampsia. Now, this isn't an amount that would decrease fevers or help you if you had a headache. So that's the difference. But for them to put that aspirin causes risks with fetuses was disappointing to read, and I don't feel like they are maybe as up to date on current pregnancy practices as they should be. You got to remember the FDA is over everything, whereas ACOG, which is the Association of Obstetricians in the United States, still recommends Tylenol. So it's confusing when these two agencies are conflicting, and I totally get that. Then, of course, Tylenol sent out the tweet to end all tweets saying that Tylenol has never been recommended for pregnant women. Editor Hillary here to say that that was actually an 8-year-old tweet that Tylenol sent out and that it didn't represent the fact that Tylenol is the safest antipyretic and anti-pain thing that's available for pregnant women. So it is an old tweet, but you couldn't tell that by the people that were like retweeting it. So, oh my gosh, what a mess, right? That is because Tylenol is covering its butt. It is actually not considered like a in pregnancy categories. They give medications different categories of if it is safe. So that would be considered like folic acid because we want you to take folic acid during pregnancy. That's in your prenatal vitamin. B would be something that is considered safe, but recommended with caution. But because of that, it is something that you should discuss with your provider. Okay, so what does all of this mean for you? I totally get that it's a lot to take in, especially if you've taken Tylenol in your pregnancy. And I'm here to say that it is not unusual to take Tylenol in pregnancy. When they have these studies, I would guess half of the pregnant ladies that I talk to have taken Tylenol at some point in their pregnancy. I know for me, I think I took it on all of my pregnancies, although I'm not 100% sure. I'm pretty sure I did though. You have to remember that our main hope is for your baby to grow in the most benign environment possible. And this includes medication, but it also includes high fevers. That is not a benign environment for your baby to grow in. In fact, high fevers can be extremely problematic, especially in the first trimester. And actually in labor, sometimes mom will get a fever and we will treat that with Tylenol because as baby is getting hotter in the womb, it takes more resources for that baby. And we want to decrease the load on the baby so that they can manage delivery successfully. In a pregnant individual, we are always weighing the risks and the benefits. And that includes Tylenol. So the women who are just like casually taking Tylenol on the internet, I'm not here for that. We should be deciding if taking that Tylenol is worth the risk. The bad news is we ultimately don't know what that risk is because the studies are lacking and difficult to do. We need more studies on this information during pregnancy, and a lot of these were done like later in time. So let's say your baby's 2 and they're going to ask you, did you take Tylenol during your pregnancy? Like me, I'm pretty sure I did, but I don't remember when or where or why. It's just hard to do. Versus some of the studies followed women during their pregnancy, asked them at every checkup, did you take Tylenol during pregnancy? And then they followed the child later on. So you can see that those 2 different types of studies are very different. But we need studies that follow pregnant women during pregnancy and after birth. I'm just here to say that they are difficult to do because postpartum women are difficult to follow up with. They are extremely busy. They have a lot going on, and sometimes they don't show up for study appointments. This is a reminder that if you are offered to do a study during your pregnancy, as long as you are comfortable with the things, please do it. We need more research done in pregnancy, and hopefully there is a financial incentive for you to do it as well, which can help pay for a whole lot of onesies or put it in the college fund. Ultimately, most people are taking Tylenol for a headache or for a fever. And honestly, in those circumstances, if you have a headache, especially first line of defense is to drink a giant glass of water because a lot of headaches are caused by dehydration, and eat and rest. So if you've tried those 3 things, that is still not taking away the headache. You might want to call your provider because headaches can be a sign of increased blood pressure or preeclampsia if you're later on in pregnancy. And if you are having a fever, again, above 100.4, I think that's something that's important to call your provider about. I think it's important that they know because infections during pregnancy can turn very quickly. And I think it's important for your provider to know that about you. In both of those cases, you'd call your provider and you would ask for their expert advice or their nurse's expert advice about weighing the risks and the benefits of taking Tylenol versus waiting it out. I am also here to say that it is annoying and unfortunate that you have so much pressure put on you during pregnancy to manage all of these different things. And when I was seeing that news conference, I was up there screaming, you know what, you're telling them to just like power through a fever, yet we do not give these people maternity leave or benefits for having their baby. It is so frustrating, and I am right there with you. And I am constantly calling my congressman to ask them to make a change in the United States of America. Remember, during pregnancy, you need a foundation of knowledge, watching something like this video, checking out the FDA statement to understand the basics of what's going on. Then you're going to employ your doctor expert. They're an expert in pregnancy, but also in you with your history and what's going on with you. Then together, you guys are going to weigh the risks and the benefits and make a plan going forward, which of course is always your choice. This is a really hard thing. And I just feel like we are piling more things on pregnant women. I'm not here for that. And I want you to know that you are doing great. This isn't fair for us to do. This isn't fair, especially if people are feeling guilt for taking Tylenol. I'm here, let that guilt go. Absolutely no reason. Again, I took Tylenol. My kids are normal. Most people who take Tylenol, their kids are totally normal too. And again, there's no causation between the two that has been found in studies. I have a whole video about feeling confident during pregnancy. I think that this can help a lot because a lot of you might just not be feeling confident right now. I'm going to put it up above. What other questions do you have about Tylenol in pregnancy? Ask me down in the comments. I might have an answer for you, or I could check it out. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth and whatever a news conference throws at you.